The United Kingdom is at the worst point of the pandemic so far, with hospitals under sustained and significant pressure and the possibility that lockdown rules might have to be tightened further still. The Health Secretary for England, Matt Hancock, issued that warning as he set out the details of a mass vaccination programme with 7 major centres open across England and more of them to come. So far, some 2.3 million people across the UK have been given a first dose of coronavirus vaccine. That's an average of just over 140,000 a day over the past week. More than 300,000 people will need to be vaccinated daily if the government is to reach its target and vaccinate the high priority groups by mid-February. Now, the vast majority of deaths with COVID are seen in the most vulnerable groups, and experts say the UK is entering the most dangerous time of the pandemic in the weeks before the vaccines can have a significant impact. Our medical editor Fergus Walsh has the latest.
Waiting patiently in line, healthcare workers in Newcastle, the over 80s in Bristol, Manchester, London and Birmingham, among 7 mass COVID vaccination centres which open today in England.
I've lost a lot of relatives, so I needed to show people that there's nothing wrong with the vaccine. It has been tested and we need to get the vaccine.
We have grandchildren, great-grandchildren, and to not be able to see them is really hard.
I feel very relieved. I feel that this is the way back. I really think that I can't understand anybody, not wanting to have it.
Are you getting the AstraZeneca or the Pfizer?
AstraZeneca. The Prime Minister in Bristol said the UK had immunised more people than any country in Europe, but the sense of urgency is palpable, with hospitals close to being overwhelmed by COVID patients.
It's a race against time, because we can all see the threat that our NHS faces, the pressure it's under, the demand in intensive care units, the pressure on ventilated beds, even the shortage of oxygen in some places.
By the end of the month, the promise is everyone in England will be within 10 miles of a vaccination centre. For now, some are travelling much longer distances and braving the cold. Such is the demand to get protected.
The vaccine programme is our way out of this pandemic, but it won't have an effect, unfortunately, for a month or two. So in the meantime, the NHS is under really intense pressure. Our hospitals are filling up with people with COVID, and we have to reverse that.
These mass immunisation centres will be open from 8 till 8, 7 days a week, part of the biggest vaccination drive ever in the NHS. The aim is to offer a first dose of COVID vaccine to up to 15 million people by mid-February. That's all over 70s, frontline health and social care workers, plus people who are currently shielding. A steady supply of COVID vaccines is vital. This GP surgery in Midlothian is one of over 1,000 in Scotland now offering immunisation. In Wales, where there's been some criticism of the speed of rollout, ministers say all over 50s will be offered a COVID vaccine by the spring. Fergus Walsh, BBC News.
Let's stay with the pandemic and our coverage of it. Let's go through the latest figures tonight. They show that there were 46,169 new coronavirus infections recorded in the latest 24-hour period, which means that on average the number of new cases reported per day in the past week is 57,851. 529 deaths were reported. That's people who died within 28 days of a positive COVID test. And this number is usually reported lower after the weekend. On average in the past week, 926 deaths were announced every day. The total number of deaths so far across the UK is 81,960. Now, there are 13,000 more COVID patients in hospital in England today than there were on Christmas Day, bringing the current total to just over 32,000. Our health editor, Hugh Pym, has been to Croydon University Hospital in South London, where doctors say that they are seeing a greater number of younger patients, many in their 30s and 40s, compared to the first wave. Hugh filmed the report with camera operator Harriet Bradshaw and producer Dominic Hurst.
It is loud and clear. COVID is serious.
Okay. The numbers are definitely increasing, and they're still increasing every day.
And I don't think I've ever known the whole system to be as stretched as it is right now under pressure.
This is A&E, but not as you know it. All staff are in full protective equipment. They know that most patients coming in have either tested positive or have symptoms.
How are you feeling now?
It's the breath that's a problem and the cough.
Can I have a little listen to your back? Is that all right?
Shubro is a consultant here.
Just sit forward for me a little and take a nice deep breath.
And he's assessing Hanifa, who's just arrived in an ambulance. She's 42. She tested positive a week before, and her condition steadily got worse.
I felt I was dying. I've been healthy, have any illness, nothing. But COVID just struck me down, just like that.
The sickest patients need to be in intensive care, and staff have to be on constant alert because patients can take a rapid turn for the worse.
It's a very, very sudden thing, and you just have to respond and reassess. And actually that patient looks like whatever the problem was we have sorted.
Staff have noticed that compared to the first wave, the age of COVID patients in intensive care is lower. For example, right here now, there are 2 people in their 30s with no underlying health conditions. The chances of someone under 40 needing intensive care for coronavirus are much smaller than for those who are older. The number of younger patients may be more noticeable because cases have risen across all age groups. Doctors are clear, no one is safe.
And I think, for someone who says, oh, it's a myth or, it won't affect me, then come and see the 30 and 40-year-olds in the intensive care with no guarantee that we're going to be able to get them out. And that's the bottom line, that's how serious it is.
You've seen some in that age group dying, have you?
Yes.
COVID is a multi-system disease, in effect, causing inflammation in all parts of the body, potentially. So we think that it affected his heart.
Alex, who's 32, suffered heart failure after going down with the virus.
My chest just felt like it was getting squeezed very, very hard. I was very surprised that it can do so much damage. I could never think of COVID being that dangerous. So I'm quite a healthy young man, quite active, play a lot of sports, go to the gym, so I was actually quite shocked. I'm lucky to be alive.
Almost half the beds at Croydon University Hospital are occupied by COVID patients. Since the start of the pandemic, they've treated nearly 2,000. But in their catchment area in the southeast of England, numbers are predicted to rise even further.
So I don't know how much more we can do before it gets to there's no more room, there's no more beds, there's no more nurses, there's no more space, there's no more anything. So yeah, I'm quite apprehensive.
Fatigue and stress for staff is more acute, and they say that takes its toll both professionally and personally.
When we came out of the first wave, I don't think any of us thought that we could do this again, and yet we are doing this again. It feels that the pressure is more sustained, and I do think that patient numbers are greater. And I think we're in for the long haul, actually.
Across the hospital, I have seen people struggle. They're tired, but I'm just proud, actually, to see how flexible people have been and adaptable to a rapidly changing situation.
Staff know whatever happens in the weeks ahead, they'll have to be there for patients, coping with whoever comes through the doors. Hanifa did not need to go into intensive care. She's been recovering in hospital. She and those who treated her have one clear message for the public.
COVID is a killer. COVID is real. Please out there, be careful. Be careful. Let's take the precautions seriously. Very, very serious.
Once again, a report on BBC News about the reality of life in some of these hospitals. Hugh, first of all, your impression of the kind of pressure that staff are working under, and then really to help viewers with where we are tonight in terms of pressure in other parts of the NHS.
Well, Hugh, one impression I came away with from Croydon University Hospital was how adamant the staff are to get a message out there to the public that this is real. As one of them said, this is not fake news. These are people seriously ill, critical care capacity, very, very busy, the hospital half full of COVID patients. And these are 30 and 40-year-olds who are seriously ill coming in. Yes, with the right treatment, they will pull through, almost all of them, but it could leave them with long-term scars and difficulties with long COVID. And this is a reality. It's not just as characterised by some people who are a lot older with underlying conditions. And in fact, the 18 to 64-year-old group in England has risen faster for hospital admissions than other age groups just since the first wave, although there's no firm evidence that they necessarily get any sicker. So what's going to happen in the next couple of weeks? That pressure will only intensify. Critical care beds fill up and then more have to be created in hospitals. Elective surgery, routine surgery has to be cancelled, but then the options get very limited. One senior doctor in South Wales has told us that at one point today, all high-level intensive care beds in critical care were full, and it's a very difficult situation. In Southend Hospital, there are problems with oxygen levels. They're having to reduce them for some patients. Management say it's a critical situation. They're having to manage it because of high demand with COVID patients. Now, case numbers may just be levelling off in London and the South East, but there's real concern in government about a sharp rise in Merseyside, among other areas, a doubling per 100,000 population just in the last week. And of course, these new cases, some of them in due course will become more hospital admissions, and that's in a couple of weeks' time.
Hugh, many thanks again. Hugh Pym with the latest thoughts there for us. Well, as we've been hearing, leading scientists and advisors are concerned that lockdown restrictions might have to be tightened if people don't comply with the rules more fully. England's Chief Medical Officer, Professor Chris Whitty, has warned that the NHS is now facing the most dangerous situation that anyone can remember, and that everyone has a responsibility, as Hugh was saying there, to take pressure off the NHS. Our political editor, Laura Kuhnsberg, has the latest.
Yes. Hi there.
The virus moves faster than the Prime Minister can get vaccines into arms. More and more of the most vulnerable, like Marion in Bristol, are receiving the jab.
Hi Marion, how are you doing?
But for Boris Johnson, this is not the time to relax.
This is a very perilous moment. Now is the moment for maximum vigilance, maximum observance of the rules, and of course, if we feel that things are not, are not being properly observed, then we may have to do more.
And with more patients in hospital with COVID than ever, it's not just doctors and nurses that have a job.
The next few weeks are going to be the worst weeks of this pandemic. We need to really double down. This is everybody's problem. Any single unnecessary contact you have with someone is a potential link in a chain of transmission that will lead to a vulnerable person.
That reminder because the streets are not as silent as the spring, where the shoppers in Beverley in Yorkshire, a residential road in Dorset, parked up with cars of walkers all heading for the beach. Data suggests we're out much more than back in March. Vesela has had the first jab of her vaccine, but is going out every day to get the paper.
This is my walk, because it drives me crazy to be at home all the time.
Lewis is opening his food stall because he still has to pay for his pitch.
In terms of the message of please stay at home, we encourage them to come out, so it's a bit contradiction.
But could changing the rules again be part of the answer?
We all want to see our loved ones. We all want to reclaim our lives. But we have a job to do first.
Do you think the government should tighten restrictions still further?
We may have to get tougher, but I think that the most important thing, if you like, is the message to people to stay at home.
There is anxiety in government, real fear that we're all just not sticking to the rules like we did back in spring. There have been conversations in Westminster about tightening the regulations still further, whether squeezing the advice on takeaways or changing how we shop. But there's no big political appetite or drive for another clampdown. One senior minister told me we've gone as far as we possibly can in terms of shutting things down. So the plea instead you'll hear again and again from scientists, government doctors and politicians: stay at home, follow the rules to make a difference to this disease. But working out the do's and don'ts isn't always easy. 2 walkers who got in very public trouble last week for driving 5 miles for a walk in Derbyshire had their fines dropped today. But the Prime Minister, known for his love of cycling, has raised Labour eyebrows, going for a ride in the Olympic Park on the other side of London, 7 miles from Downing Street. Number 10 is adamant tonight he did nothing wrong, but whoever and wherever you are, it's not always straightforward to get a glimpse of life outside. Laura Kunsberg, BBC News, Westminster.
Now, head teachers have called for limits on the number of pupils who are allowed to attend school during lockdown because of attendance rates surging in some areas in England and staff reporting streets packed with parents during drop-off. Our education correspondent Elaine Dunkley has the story.
At Parkinson Lane Primary in Halifax, teachers are struggling with the numbers. During the first lockdown, 13 pupils attended. Today, there are more than 17 classes.
I mean, you say lockdown, but it doesn't feel like a lockdown, does it? I mean, teachers are having to split their time, not only teaching the children that have come into school, but also you've then got the vast majority that are trying to get online. We've had children go home with COVID and pass it on to grandparents who are living with them, and those grandparents sadly have passed on.
More than 600 pupils here are eligible for a school place, according to the government's criteria. A child needs one parent who is a key worker to be in school, and the government has expanded the offer of a school place to children who lack devices for remote learning and for those without a space to learn at home. Sajida is a teaching assistant and Iram is a school receptionist. Both are key workers, but have come to different decisions on bringing their children into school.
My child is actually at home because me and my husband have had to make the decision because of the infection rates and because the government told us schools are closed.
I've got the younger one here because I can't leave her on her own. My husband works, he's a key worker as well. So this time round, of course the infection rates are higher, but what they're feeling is that social interaction, the mental health side, is more important.
Just down the road at Ash Green Community Primary School, classrooms are full. The government says all children who can stay at home should, but the head teacher says parents are being given mixed messages.
To have advice like last week coming from the Secretary of State for Education, who said that children without laptops should report to school, is just extremely unhelpful, and there's going to have to be things that come in place, possibly looking at whether it's both parents being critical workers, possibly whether that list needs to be less ambiguous and it needs to be slimmer.
The government says it expects schools to work with families to ensure that all critical worker children are given a place. But some schools fear unless there is a limit on numbers, the lockdown will do little to stop the spread of the virus. Elaine Dunkley, BBC News in Halifax.